We will discuss a hidden threat to our health that comes from plastic bottles and plastic containers. It is important to understand which of them are harmful, which are safer alternatives, and how to reduce or avoid the risks associated with plastic bottles. Most water and soda bottles are made from polyethylene terephthalate, also known as PET. These bottles are safest when used once and kept at low temperatures. However, using them for extended periods increases certain risks. When reused or exposed to heat, they release small particles called antimony. Antimony is a heavy metal that can damage cells and cause oxidative stress. Although the amount of this leaching is very low, and thus the risk is considered minimal, it is still something to be aware of. Another issue arises when plastic bottles degrade into microplastics due to repeated use or exposure to sunlight. These microplastics, which are nanomolecules, can be absorbed into the body and deposited in cells. They can cause cellular damage and inflammation. Moreover, they can bind with toxic substances and spread through the body. While this is a real concern, more studies are needed to fully understand the risks associated with microplastics. Bacterial contamination is another risk when bottles are used for extended periods. The growth of bacteria in bottles can lead to digestive infections, which is one of the most common problems associated with reused bottles. Plastic bottles can also release acetaldehyde, a toxin that is classified as a possible carcinogen, meaning it may increase the risk of cancer. Although the amount of acetaldehyde released from plastic bottles is very low, it still presents a potential risk. The most serious risk comes from xenoestrogens, which are chemicals released from certain plastics but not typically from PET plastics. Xenoestrogens are more commonly found in reusable plastic bottles and containers. These compounds mimic the female hormone estrogen and can cause endocrine disruption. In women, this may lead to irregular menstruation or infertility. In men, they can negatively affect testosterone levels, and in children, they may interfere with normal growth. Well-known xenoestrogen is Bisphenol A or BPA. This bisphenol is a component in older water bottles or reusable water containers. Also, they are a component of epoxy resins and some bottle tops. To avoid these negative health effects, it is recommended to not reuse plastic bottles. Keep plastic bottles away from sunlight and avoid exposing them to high temperatures. Safer alternatives include glass or stainless steel bottles. Another commonly used plastic is polypropylene or PP, which is popular for reusable food containers, plastic bottle caps, and yogurt containers. Most microwave-safe dishes, cutting boards, and utensils are made from this plastic due to its resistance to high temperatures. Even though polypropylene is resistant to high temperatures, over time it can still release microplastics, which may contaminate food. However, the risk is considered minimal. Polypropylene is one of the safest plastics for human use. Another important plastic is nylon. Many kitchen utensils are made from nylon because it is more heat resistant than polypropylene. On the other hand, less safe plastics include polyvinyl chloride or PVC, which is commonly used in food wraps and water pipes. PVC becomes especially harmful at high temperatures. It contains phthalates, which act as anti-androgens, meaning they interfere with male hormone function. Phthalates are linked to reproductive problems and obesity. It is advisable to avoid using plastic wraps made from PVC for hot or fatty foods and to avoid microwaving food in PVC containers or wraps. Many disposable cups and plates are made from polystyrene, which is either foam or rigid plastic. Polystyrene is commonly used in takeout containers and egg cartons. It contains styrene, a known carcinogen, which can leach into food and drinks when heated. Long-term exposure to styrene may increase the risk of cancers such as leukemia and lymphoma, though more studies are needed to establish clear risks in humans. Low-density polyethylene, or LDPA, is another plastic used in grocery bags, sandwich bags, and some food wraps. In fatty environments, LDPA can leach additives that may be harmful to humans, which is why it is not recommended to heat or use this plastic with fatty foods. To summarize, most plastics currently used in the food industry are relatively safe for use, but it is better to avoid using plastics for long-term storage at high temperatures or with fatty foods. Alternatives like glass or stainless steel are safer choices, especially for food storage and heating.